Hi, I'm Dr. Mary Sebzda, and I work here as one of the staff veterinarians at Newport Harbor Animal Hospice, and I specialize in canine and feline reproductive medicine.
Dr. Sebzda, what are brachycephalic dog breeds and what makes them unique?
What an excellent question. So this is a prime example of a brachycephalic breed, the French Bulldog, the number one most popular popular brachycephalic breed in North America at the moment. And you are a 10, darling. But oh, that face that causes all the snoring and the gassiness too. So brachycephalic breeds are atypical from most dogs in that they have the shortened face. So from the back of her skull to the tip of her nose, it's a much shorter distance. And we can see that in shortening that distance, we have the same amount of teeth organized in a shorter space. We end up with these prominent facial folds, and the respiratory tract is reduced in length and kind of all squished together. Now, if I compare her to the typical breed, like your English Labrador here, you can see that their face from the back of the skull to the tip of the nose is a lot longer. We also see that their nostrils tend to be much more open. They don't have the same reduced space and crowding of all of their teeth. And the airflow from their nose to their lower airways is a bit smoother as well too. So again, using our French Bulldog as an example of a brachycephalic breed, what also makes them unusual and unique about their airways that we can see is they'll have narrowed openings to the nasal cavity, but they'll also have reduced space for air flowing over the nasal turbinates as air comes in through their upper airways and passes by the soft palate and then heads down towards their trachea. Some other unusual features of the brachycephalic dog include that they'll have a thickened tongue and a thickened soft palate as well too, again reducing or restricting airflow in their upper airways. They may have at the point of the opening of their trachea something called eversion of the laryngeal saccules, which are two little flabby tissue pieces that can come out from either side and again occlude that upper airway. And lastly, some of our brachycephalic breeds may have a narrow trachea, often called a hypoplastic trachea. So these are the basic conditions that lead to abnormal and restricted airflow in the brachycephalic breed.
What is brachycephalic obstructive airway syndrome?
Again, another excellent question. So it can also be called BOAS for short, but brachycephalic refers to, again, the shape of their face being shortened from front to back. Obstructive means, of course, that airflow isn't moving in a nice laminar fashion. It's actually going over twists and bends and creating a turbulent type of airflow. In practical terms, this usually means we hear things like a roaring or a snoring sort of sound as air moves over those restricted airways.
What are the common health issues in brachycephalic dog breeds?
The common issues. Well, apart from just the little bits of snoring and the abnormal airflow that we can get all kinds of issues. Starting with in the oral cavity, again, we can have crowding of all of those teeth and rotation of the teeth leading to periodontal disease, tooth loss, bad breath. We can have problems with dogs getting overheated really quickly. In case you didn't know this, most of cooling in the dog actually happens through the respiratory tract through panting. So dogs that have restrictions to airflow can actually get overheated and give themselves heat stroke really, really quickly. It doesn't take much, just a quick walk on a hot day. Sometimes just even overexertion at play can result in heat stroke with these dogs. In addition to that, we can have, that obstructed upper airway cause problems on the digestive system, something like esophageal reflux or GERD like we would see in people. We can see hiatal hernias in the dog. We can also see, again, because they're mostly breathing through their mouth and less through their nostrils, we can see lots of swallowing air leading to flatulence. And again, because I do reproductive medicine in this hospital, something that's near and dear to my heart is seeing the effects of these restricted upper airways and what they have on the reproductive system of the dog as well too. In male dogs, I may see the condition urethral prolapse. in those dogs, which can lead to both blood in their urine and sometimes difficulty and straining to urinate. And in the female dogs, we can see difficulty at birth. Why difficulty at birth? Some people claim that it's just, the relative size, the large size of these dogs' skull to the small size of the pelvis in the female. But really, that's not all there is to it. Late in pregnancy with these dogs, especially if it's a large litter, they have a big slack abdomen. And yes, the puppy's head size is kind of large relative to other breeds going through maternal pelvis. But picture this. If you're a mom with a big abdomen and you have to deliver more than 5 puppies and you've got the equivalent of a snorkel on your face, how well do you think you're going to push in labor and delivery? Probably not well. So a lot of our brachycephalic breeds, English bulldogs, French bulldogs, the Chinese pug, Boston terriers, typically these dogs, it's recommended to have an elective C-section as opposed to letting the mother go through a painful and difficult labor and run the risk of losing puppies.
How can I tell if my brachycephalic dog is experiencing breathing difficulties?
Well, a lot of the times we can hear the difficulty breathing by increased noise. But also signs of a dog that's struggling to breathe, especially for a brachycephalic, include getting bright pink or bluish mucous membranes. And sometimes you'll even have the appearance of a lot of saliva or what we sometimes refer to as froth at their face, because they're actually struggling to be able to swallow and breathe at the same time. You may also notice things like the dog just looking like they're tired and exhausted and choosing to lay down a lot.
What are the best ways to manage breathing issues in brachycephalic dogs?
So the best way, knowledge is power here, is to actually be aware of how severe the dog's brachycephalic condition is. And there was a grading scale that was developed at the University of Cambridge and has now been adopted by the Orthopedic Foundation for Animals as well too, to rate these dogs from a scale of 0 to 4 to basically describe how severely affected a dog is with their brachycephalic syndrome and how much of an obstruction to their upper airways that's creating. You can, of course, have respiratory function evaluated by your general veterinarian. And we do recommend that all breeders have the respiratory function grading system certification of their dogs prior to use in a breeding program, so that we can not only evaluate how severely the dog may be affected and remove the most severely affected dogs from a breeding pool, but that way we can rate these dogs and make valuable decisions about which dog to breed to which dog, so that over time, if we have even mildly affected or moderately affected dogs, we can move away from their syndrome into selecting offspring that are less affected.
Is anesthesia safe for brachycephalic dog breeds?
Glad you asked that. In general, anesthesia can be made safe, but these dogs do have the special complication of these restricted airways, which means that both prior to induction of anesthesia and after in recovery from anesthesia, we're going to worry about successful airflow in these dogs. So these dogs may receive pre-oxygenation, and we have to closely monitor them both before and after anesthesia to make sure that their airways stay as open as possible. Just as a good physical example for you, on the bottom, we have a more mesocephalic or normal airway dog where you can actually see the endotracheal tube in place in the dog's upper airways. And you can see quite a large pathway where we're going to have good airflow through that dog at all times. Even mildly sedated and removing this endotracheal tube from the dog's upper airway, we would still have to monitor that dog to make sure that its upper airways don't become obstructed. Now, if I compare that to this severely brachycephalic animal above, you can see that only a tiny little endotracheal tube was even able to be passed through this dog's upper airways. This dog is going to have to be very closely monitored and managed post-anesthesia in recovery to make sure that those airways remain open at all times so we don't have respiratory arrest.
What surgical options are available for severe breathing problems in brachycephalic dogs?
In mild cases, your general practitioner may talk to you about correction of the upper airways, such as with the nasal passages. We can open up those nasal passages so that they change from the slit-like appearance that they may have into the more open appearance. Soft palate correction is often done by many a veterinarian as well too. But in more severe cases, like eversion of the laryngeal saccules or hypoplastic trachea, you may actually require the services of a veterinary specialist in surgery that has advanced equipment and knows advanced techniques for correction of those. In every case, these surgeries can come with complications. So it's really ideal to sort of choose and select the least affected dogs in the beginning so that we have better success over their lifetime.
What should I know about choosing a puppy from a brachycephalic breed?
So they are adorable, aren't they? So we don't want to just pick the most energetic and the cutest one from the pack. What I look for in selection of puppies is to, again, evaluate their nasal passages. This puppy actually has pretty good upper airways in that its nares are certainly still narrow when I compare them to the Labrador, but they're not actually slit-like as they can be in some of the more severe cases. I'm also listening to the puppy to hear that if at rest and play, it's doing a lot of heavy breathing, a lot of very noisy, almost roaring type sounds. But most importantly, it's when I talk to the breeders about their stock and who should breed and who should not. Again, the University of Cambridge initially started a system on rating dogs. Currently, it's only available in the English French Bulldog and the Chinese Pug. But the respiratory function grading scheme evaluates on 4 different classes from grade 0 to grade 3. We would obviously want to select out all of the grade 3s and not use them in a breeding program. But if we had a grade 2 dog in particular that showed high genetic value in every other situation, it may tentatively be used, but we would want to select for it a partner that was a grade 0 or a grade 1, and then eventually replace that grade 2 dog with one lesser affected offspring from it so that eventually we could make best choices and breed away from those disorders.
What are the risks of traveling or flying with a brachycephalic dog?
With a puppy this cute, you probably want to travel everywhere with it. But again, as I mentioned that dogs who are even highly stressed are prone to heat stroke just because of their restricted airways. It's a concern when you put your animal through the stress of airplane security and take them on a flight. Also, at altitude, oxygen is going to be a little less available, and these dogs are going to labor more at breathing. So it is a concern to take severely affected dogs with brachycephalic obstructive airway syndrome on a flight, and certainly there are some airlines that will even refuse to carry dogs of these type of breeds because of the concern for their safety.
How can I improve the overall quality of life for my brachycephalic dog?
Talking to your veterinarian and staging them as far as how severely they are affected with brachycephalic obstructive airway syndrome is always a good idea. It's good to know what you have so that you can plan for the future. But simple measures like having a relatively stress-free environment for the dog, limiting their activity to only what the dog can tolerate for short periods of time, observing for signs of distress while breathing, and certainly avoiding activities like heavy activity on a hot day, perhaps even avoiding travel on an airplane in severely affected dogs would be a good way to manage your pet. So if you're either a pet owner who has questions about their brachycephalic dog and brachycephalic obstructive airway syndrome, or you're a breeder of brachycephalic breeds and you want some help in selection of best breeding practices and selection of the breeding pair, please, by all means, reach out to us, give us a call. We're here to help.